Hi, my name is Dr. Muhammad Irfan. Today I would like to describe the ultrasound of the breast, normal versus abnormal image on the ultrasound. I will describe the normal ultrasound image of the breast and then I will describe the pathologies of the breast which are shown on the ultrasound. This is the Byrad's classification of the pathologies of the breast which are shown on the ultrasound or mammogram. What is BIRAD's breast imaging reporting and data system? It is categorized into six types almost. In BIRAD 0, need additional image or prior examination. What will be the management? Recall for the additional imaging and await prior examination. In BIRAD 1 category, this is the negative image and the management is routine screening. In the BIRADS 2, this is the benign and routine screening is advised. Barrett 3 probably benign, short interval follow-up of 6 months is advised. Barrett 4 is suspicious, so it has three types: 4A, B, C. Low suspicious 4A, moderate suspicious 4B, and highly suspicious 4C. Then there is Barrett's 5, highly suggestive of malignancy. Next is Barrett's 6, known biopsy or proven case of the malignancy. Surgical excision is advised for this. So the most of the breast lesions which we see on the ultrasound or mammogram mostly are benign, probably benign, or maybe uh, 4, 5, or in 6 category like the suspicious, highly suggestive of malignancy or known biopsy proven cases. Now we will discuss these lesions, uh, how we can categorize them, and on the ultrasound and the mammogram. This is the normal mammogram image where you can see that there is a nipple, fibroglandular tissue, fat, and pectoris major and minor muscles are shown. Mainly, there are two views of the breast mammogram. Craniocaudal view, which is shown here, is the left craniocaudal view, and the left MLO view, mediolateral view. So, breast mainly composed of fat and fibroglandular tissue. Fat and fibroglandular tissue. So, this is the normal mammogram. The rest is categorized on the base of the how much fibroglandular tissue or the fat is present in the mammogram or ultrasound of the breast. This is the normal image of the ultrasound of the breast. First of all, there is skin, subcutaneous tissue, and there is subcutaneous fat, the fibroglandular fat, retromemory fat, then pectoral major, minor muscle, and intercostal muscle are shown. I will show you this is the subcutaneous fat, this is the retromemory fat, this echogenic area is the fibroglandular fat, and this is the superficial facial layer and deep facial layer. These are the ribs, intercostal muscle, pectoralis major, and minor muscle. This is the normal anatomy of the ultrasound of the breast. This is the feature of the simple cyst on the ultrasound. Smooth, oval, anechoic with posterior acoustic enhancement. You can see this is the smooth anechoic with the posterior acoustic enhancement. On the Barrett's, it is categorized into Barrett's 2. So this is the benign. This is the lipoma on the ultrasound breast. This is the lipoma on the ultrasound breast. This is hyperechoic, this area in the breast, and this is categorized in the barriers 2. So this is the benign barriers 2. This is the fibroadenoma of the breast. Fibroadenoma of the breast. So this is a hypoechoic mass with a capsule. As you can see, this is the soda capsule, echogenic area, macrolabulated margins, macrolabulate margins. Fibroadenoma appear as the hypoechoic masses with thin pseudocapsule, macrolabulated margins, and these are wider than the talar, and these are categorized in the Barrett's 2. So the fibroadenoma is categorized in the Barrett's 2 lesion. How it appears? It is the hypoechoic, solid looking, and it has this thin pseudocapsule, echogenic, hypoechoic, and it has the macrolabulated margins. The benign feature of any mass on the ultrasound is it is wider than the talar, and mostly the benign, whenever there is a benign mass on the ultrasound of the breast, it will be wider than the talar, while the malignant mass is always taller than the wide, and malignant masses have irregular wall, this while it has smooth wall. So this is the case of the fibroadenoma of the breast. This is another case of the fibroadenoma of the breast. Hypoechoic, wider than talar, and thin echogenic pseudocapsule. These are the feature of the fibroadenoma of the breast. This is case of the galactocele on the ultrasound of the breast, and this is the case of the galactocele on the mammogram. On ultrasound of breast, galactocele appear as fat fluid level. This is the fluid level in the dependent part, and this is the fat level. Fat fluid level is noted in the case of the galactocele on the ultrasound of the breast. Galactocele have varying appearance. They may appear as cystic solid areas or complex cysts, or they may have simple multicystic appearance. This is the case of the galactocele on the mammogram. This is the fat, and this is the fluid level. Fat fluid level. They basically appear as the cystic solid with fat fluid level. So this is the case of the galactocele of the on the ultrasound of the breast. This is another case of the galactocele of the breast on the ultrasound. This is the case of the abscess on the ultrasound. How it appears? It appears as anechoic area or hypoechoic area with internal echoes and irregular wall in the breast. These are the irregular wall. This is the case of the abscess on the ultrasound. This is the typical case of the mastitis on the ultrasound. Mastitis appears at the hypoechoic fat globules with some hypoechoic areas, and there is skin thickening is also noted. This is the case of the mastitis on the ultrasound, typical case on the ultrasound of the breast. Hypoechoic fat globule, hypoechoic areas, and some skin thickening. This is the case of the sebaceous cyst which appear on the ultrasound. This is the hypoechoic. They appear as the hypoechoic heterogeneous areas close to the skin, and they will give the posterior acoustic enhancement. It is categorized in the Barrett's 2. Hypoechoic areas are heterogeneous areas with the close to the skin. This is the case of the infected sebaceous cyst. This is case of the complex breast cyst. Complex breast cyst. Complex breast cyst is categorized in the Barrett tree. They appear as the complex cystic solid masses. This is the solid area and this is the cystic area. So they are categorized in the Barrett tree. They have varying appearance, may appear as cystic solid area or thick septas, also noted, and it has varying appearance. So this is categorized in the Barrett 3 category. This is case of the fat crosses on the ultrasound of the breast. They appear as the hyperechoic area in the acute stage. It is categorized as Barrett 3. This is case of the intraductal papilloma. Dilation of the duct with a nodule in it. Typical appearance of the intraductal papilloma. This is categorized in the Barrett's 4 category. This is Barrett's 4 category. This is case of the intracystic papillary carcinoma. It appears as complex cyst with thick mural nodule. This is the complex cyst. This is the mural nodule, and color Doppler flow is noted inside the nodule. This is categorized in the Barrett 4. Complex cyst. Sometimes it appears as complex cyst with some thick septas and mural nodule. And the mural nodule, the color Doppler flow is noted. So this is the case of the intracystic papillary carcinoma of the breast on the ultrasound. This is Barrett 5 case. Barrett 5, when we describe the Barrett 5 on the ultrasound of breast, they are the taller than the white with irregular wall. And color Doppler flow is also detected. This is case of the Barrett 5. While in case of benign lesion of the breast, they are wider than the taller. These are taller than the white Barrett 5 category lesion, malignant lesion which are. And color Doppler flow is also noted. This is step ladder sign which is seen in case of the intracapsular rupture of the breast implant. This is called the step ladder. This is the snowstorm sign which is seen in case of the extracapsular rupture of the breast implant. In case of breast ultrasound reporting, we write the normal fibrofatty parenchyma seen, no mass lesion seen or other abnormality seen, no axillary lymph node seen, and the normal second thickness seen. So while describing the ultrasound of the breast, these are the 4 things which are included in the ultrasound report. Number 1, normal fibrofatty parenchyma, no mass lesion or abnormality, no enlarged lymph node, and normal second thickness. So in this lecture, I described the lesions which are seen on the ultrasound of the breast, normal versus abnormal image. Hopefully you will like this lecture. Thank you very much.